All right, I am gonna start by gathering my supplies. So I'm looking at my order. So today I'm going to be administering Ketorolac 15 milligrams intramuscular for my patient who is a female, an older female dealing with some general muscle soreness and some chest pain. So we're gonna try and reduce that with this Ketorolac. I'm gonna gather my things as I'm administering 15 milligrams. I'm gonna look on my thing, and 15 milligrams is going to be, in my bottle, it's gonna be a, oh goodness sakes, it's gonna be a half of a milliliter. So I'm gonna get a 1 milliliters thing, and then I'm gonna get a 23 by 1.5 because I'm doing it on an adult. I'm gonna get my alcohol pads ready and my Band-Aid, and I'm gonna do my first check of just checking the patient's medication with the order, and they do look correct. I'm also gonna look to see if the patient has any allergies in the chart, which I'm not seeing any. I'll verify that with them in the room. I'm now ready to pick my medication out and get started. So I'm going to grab out the Ketorolac tromethamine is what I believe that's how you pronounce. And I'm gonna look at this, and it's 60 milligrams per 2 milliliters or 30 milligrams per 1 milliliter. And my thing requests 15 milligrams, so that's gonna be a half of a milliliter like I talked about earlier. I'm going to check that it is, everything else looks good, oral, or intramuscular, I apologize, and that all looks good. So I am now ready to get this. I'm gonna do some hand hygiene. Make sure that's good, and put some gloves on. Okay, 1 and 2. All right, I'm gonna open an alcohol pad, and I'm going to clean off the surface of my medication. Get it all clean. And I'm gonna open up my thing and my needle and pull this out and screw it in, pulling that out as well. Put my garbage to the side. Okay, I am going to pull this back, and I'm gonna pull down to 0.5 as that's what I'm administering. Uncap and sit on the table where I can do my capping technique. Put this in, air, tip it upside down, and I gotta pull my needle down a little bit. I'm gonna pull down a little bit past 0.5 as I do have a bubble. I'm gonna tip it back down and do the one-handed method. Perfect. Okay, let's make sure that there's no bubbles for my patient, and pull back up. Perfect. I have 0.5 of my medication. Okay, now that that is drawn, I'm going to stick that there, and I'm ready to go into the patient's room. I'm gonna do my second check, so I'm ready to go. All right, we're gonna bring this around here actually. All right, knock, knock. My name is Sophie, and I am your student nurse today. I'm here to give you a medication as prescribed by your doctor. Can you first tell me your name and your date of birth? Perfect. Okay, I am gonna scan the barcode now. Let's try one more time. All right, we're gonna try a different way. We're gonna do this. And you're verified. Perfect. Now that I have my 2 patient identifiers, I don't know if I said already, but I'm always gonna make sure to close my curtain for protection and safety of my patient. Now that I have this in here, I am going to scan the medication as my third check. Might pull the tape off a little bit. Okay, let's try again. Perfect, that did pull my medication up. I'm gonna do that final check with my thing. I'm gonna look at the Nursing considerations as well. I'm going to look at the administration, the indications and dosages, any nursing considerations, patient teaching, the action of the medication itself, and all of those things, which that looks good. I'm just going to make sure to tell my patient that this will cause some muscle pain, which we're going to do in the deltoid area, as that is preferred by my patient, and everything looks good. So I'm going to do my 6 rights now that I've done my 3rd check. I'm going to check my right patient, which my patient has confirmed. I've checked my right medication, which is Ketorolac tromethamine. That looks great. The right time, which it is scheduled for right now, as administered on the paper and on the computer. The right route, which is intramuscular, which I have on both things. The right dose, which I have compared my dose, and I also prepared my dose, and I will check that. Perfect. And then that right dose is 0.5 milliliters, by the way, just so I confirm that. And then the right reasoning, which my patient has some pain, and so we're here to do that. So do you have any allergies? No? All right, I'm gonna set this to the side and lift up the bed. All right, have you taken this medication before? Perfect, so you kind of know the side effects. I'll review them with you. Side effects can include some tenderness and pain in that injection site, along with some arm weakness a little bit, and then you might experience some GI symptoms, which if that's the case, just let us know, as we do want to make sure to take good care of you. All right, I am going to clean the site now. All right, this is going to be a little cold. I'm going to start from the middle and work my way outwards. All right, that looks clean. Let's throw that in the garbage. Okay. All right, I am going to change my needle, not because I feel like I have to. I would not do that. I would just take it off. But because I feel like I want to keep the most clean, sterile feel for my patient. So I'm going to take this and put a new one on, and I'm also going to change my gloves. Since I cleaned with those other gloves, I am going to clean one more time. I just want to keep everything as clean as possible for my patient, and I should have changed my gloves prior. So one more time, just to make sure my patient's arm is cleaned properly, because I did that incorrectly. Now I am ready to administer. There is going to be some pressure upon administration, along with a slight poke when I do administer into your arm. Are you ready for this? All right, normally I would do the Z-Track method. Given that this is a mannequin, I'm not very capable of being able to do that. All right, I'm going to dart this in a 90-degree angle. 3, 2, 1. Okay, I'm going to administer 1 milliliter per 10 seconds, and I'm doing 5, so continue about 5 seconds. And pull out at a 90-degree angle. I'm going to put on my safety thing and directly into my sharps, which I'm going to prepare my Band-Aid now. Do not put this in, do not massage the medication in. Okay, all right, and I do want to specify that I did not clarify earlier. I'm only going to administer or prepare one medication for one patient at a time, as that's crucial to not mix up medications or cause any issues. So I'm now going to put this on and take my gloves off. I'm going to do some hand hygiene. All right, how are you feeling? I'm going to go get this documented. Let's get in a comfortable position. I'm going to raise your thing back down. That's comfortable there. All right, and I'm going to lower it all the way down to the bottom. Like I said, remember, if you have any arm pain, any swelling, any uncomfortableness there, let us know. We do want to make sure you're taken care of, but it is normal. And then along with those GI symptoms, if you're feeling any discomfort there. All right, thanks.